Hi, I'm Dr. Kelsey Offenwanger. I'm a psychologist at the Marshall Clinic Health System. A psychologist is a doctor who diagnoses and provides treatment and support to children, teenagers, and adults who might be dealing with social, emotional, medical, or mental health difficulties. I specialize in providing consultation and therapy to children and their families who experience behavioral difficulties, social challenges, and developmental concerns. In my free time, I enjoy water skiing, playing fetch with my dog, and going fishing with my family. Today, what we're going to do is a couple mindfulness activities and review 5 tips to support mental health, family life, and living successfully with BBS. So, mindfulness is a term you may have heard before, and what it means is being present in the moment. And it is how I start therapy sessions with children, teenagers, and parents. Mindfulness can include simple and effective breathing techniques to help train our brain and bodies to remain calm and focused. The bonus to mindfulness is that we can do it anywhere at any time, even without people noticing. So what we'll start with is a simple mindfulness activity called hand breathing. So what you do is you can either hold your hand up in the air or you can put it down on a desk. I'll hold it up so you can see. You then take your other hand and you start at the base of your thumb. And what we'll do is we'll slowly breathe in through our nose, like we're smelling a flower, and breathe out through our mouth, like we're blowing out a candle. And we'll do that 5 times as we trace our fingers up and down. All right, let's get started. So first we'll slowly breathe in like we're smelling that flower. We'll pause at the top and slowly breathe out. Breathe in like you're smelling that flower. Pause and breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Last one, big breath in. All right, big breath out. Nice work. Now that we're more calm and focused, let's jump into our 5 tips for today. The first tip that can be really helpful is getting a prescription for information. We get prescriptions for other things, but knowledge is powerful. So checking in about information can be really helpful and help us feel more secure in our treatment. The more you know about BBS, the better equipped you'll be to understand what's happening and why. Talk with your medical team and make them your partners in your care, both here at the Marshall Clinic Health System and at home. Number 2, make healthy family goals. Part of the treatment for almost any chronic medical or mental health condition involves lifestyle changes. I know, the ones we hear about often, exercising, eating healthy, but there's also some other ones that are really important, such as socializing and self-care. During these times, it may be harder to socialize, but we can do this by video, like you see me here on the screen, or you can do it over social media or a different means. Families who also make changes together are more likely to have success managing medical and mental health conditions throughout their lives. To help you stick with it, choose an activity that's fun. Set a realistic goal and celebrate your progress. I'm not a marathon runner, so I'm not going to start setting a goal to run 5 miles a day. I may start with walking for 5 to 15 minutes and slowly step up from there. Number 3, beware of depression and worries. Experiencing BBS for yourself or family member can be really overwhelming. Shame, guilt, anger, confusion, thinking that it's unfair is all common for people with BBS and other medical conditions. The Office of Disease Prevention and Health Promotion make it clear that mental health is essential to a person's well-being. Children, adolescents, and adults with untreated mental health disorders are at higher risk for many unhealthy and unsafe behaviors. This can also increase BBS symptoms. Fortunately, there are a number of mental health disorders that can be treated effectively and potentially prevented. Early diagnosis and treatment can lead to longer, healthier lives that include decreased job and school stress. In addition, when we feel better mentally, we tend to feel better physically too. Number 4, talking with others. Doctors, nurses, social workers, other healthcare professionals may not always be the best resources about what it's like to recover. For example, they may not have experienced bariatric surgery or vision loss. Therefore, trying to get some of that insider information can be really beneficial. So talk with people and family members who experience BBS. Sharing with and learning from people who have the same feelings and potential experiences of you can help you feel connected, can help you feel more safe talking about your feelings, and can help you cope. Connecting with BBS groups on Facebook, social media, and medical communities can be another really helpful way to have support. I know that for me, talking with other parents that go through the same situation can make it a lot more efficient to handle different experiences that come up and help you not feel as alone. I bet there's someone else that may be going through the same thing that you have experienced. And if not, maybe we can learn from other similar experiences. Another thing that is key is telling others about BBS. You may find it challenging to think about how to share that information. You may worry that other people don't want to know. Ugh, what may they say? Are they going to judge me? It's okay and normal to have all these feelings. You may also feel embarrassed and scared. But try rehearsing to yourself or a loved one first about what you may say. Practice it going well in your head, thinking positive, or using what we call positive self-talk. I can tell you from experience that thinking about telling people is often harder than actually telling them. Number 5 is remembering that self-care. You may look or feel fine most of the time. However, at some point, you may have an off day. A symptom may increase, or we just may be feeling more fatigued. When this happens, you want people in your court. You want people to know about the ways BBS might affect you or your loved ones so they can understand what you're going through. For example, if you have epilepsy, your coworkers should know what the symptoms are or what you should do if they have a seizure. If you have diabetes, you want someone to be able to help you check your symptoms or what are symptoms of low blood sugar. Or if you have BBS, friends and family members should know that you might not be able to drive yourself to an appointment at night, or your child may indulge in some of those extra desserts you have on the table. Letting your loved ones and friends know this can help you. If you feel as though you might need someone else to talk to, or if you don't know someone who can help you, reach out to your medical team. They can help connect you with different service providers or mental health professionals in your area. All right, so to recap today's video, we discussed 5 different tips that can help support mental health, family life, and living successfully with BBS. We talked about getting a prescription for information and educating ourselves, making healthy family investments to feel better socially, emotionally, and physically. We talked about being aware of our thoughts and feelings, communicating with others about BBS, and remembering to take care of ourselves by reaching out to others for support. Those are the 5 tips that I wanted to share with you all today. I know that we're able to answer questions, and I greatly encourage you to reach out with any questions that we shared today or any other behavioral health, mental health, or social health challenges that you may have and how we can best help or how I can help you find the resources. Thank you again for your time. My name is Dr. Kelsey Offenwanger.